Hey, Dr. Crifase here, and today we're going to be discussing how to choose the right doctor to help you with your thyroid condition and your thyroid symptoms. And I'm going to be going over 8 different ways to make sure that you know that you are on the right path and you're working with someone who's getting to the root causes of your thyroid condition. Now, I know that it can be tough and confusing to sift through all of the noise and confusion on the internet regarding thyroid health and what you should do if you are experiencing any thyroid symptoms or issues. So what you first want to look for when you're deciding who you're going to work with to help you with your thyroid is your proper diagnosis of thyroid disease, including Hashimoto's. And now this is really important as Hashimoto's makes up about 90% of all thyroid conditions and is one of the most common autoimmune diseases in the United States and now the world. So often, thyroid disease is misdiagnosed, and this is what leads to the chronic disease and why so many people are suffering in the world with thyroid disease. The second thing is if your doctor is running the right laboratory tests for you. This is a really huge point and kind of touches on the previous one because it is so important, number one, for the correct diagnosis and management of thyroid disease. There are many other lab tests besides TSH and T4 that need to be run, and on top of that, need to be run at the proper times, along with making sure your lab levels are not just normal, but optimal. For example, the time of day or time of your menstrual cycle can throw off your test results, as can certain medications or supplements as well. So it's really important that your doctor or whoever you're working with is running the proper tests and putting that information together for you so that you understand what is going on in your body. So it's because of this that we cannot rely only on antibody tests. What we must rely on then is 3 additional findings, which are number 1, a high to normal TSH, number 2, certain symptoms of hypothyroidism, and number 3, evidence of some sort of structural change to the thyroid that can be found on either a physical exam or an ultrasound. Number 4 is you want to make sure your doctor is looking to fix the root causes of your thyroid problem. You know, there are so many reasons that your thyroid can become dysfunctional, from nutritional deficiencies to chronic stressors to environmental sensitivities. The list is very extensive. And far too often I see people stuck on medication with no effort being put by their doctors to find the root causes and to actually fix their problems once and for all. Number 5 is your doctor screening for thyroid cancer. Now, this is a really important point as thyroid cancer is becoming one of the most common cancers among women in the United States. The worst news about this is that everyone who has thyroid disease at any level is also at risk for thyroid cancer. Now, I've sent countless people to get thyroid ultrasounds done to screen for this, and shockingly, only about 2% of patients I've ever seen have ever been sent for this previously in their lifetime. Let me give you an example of one patient of mine who was on Synthroid for literally 40 years. She had told me that she had some test done about 40 years ago before they put her on medication, and that the doctors had told her that she had almost no thyroid gland left. So I asked her, had she gotten any ultrasound done since then in this 40-year time span to confirm that statement that she had almost no thyroid gland? And she said no. She didn't have anything. Nobody sent her out for one in 40 years. So I sent her out for a thyroid ultrasound. And lo and behold, she did indeed have a full working thyroid gland. And luckily, there was no cancer and there was no cysts or any other issues going on directly on the thyroid. However, it did explain the unusual symptoms she was having from being on thyroid medication for 40 years, which is why she came to me in the first place. So the thyroid ultrasound is severely underutilized, yet it provides so much insight, and it's really important in screening for thyroid cancer. Number 6 is you want to make sure that you're on the right diet for yourself alone. You know, diet plays a major role in overall health, and knowing which foods you may be reacting to that can be affecting your thyroid is very important. It's not as simple as knowing which foods are good or bad for the thyroid, as it's a lot more personal than that. So it's really important to know which foods fit you and your body and biochemical individuality best. Now, a majority of food allergy tests are inaccurate, but there are a small portion that are accurate and true. And so for someone who knows which foods they are reacting to, this helps to fine-tune the diet even further. And the nice thing is that most people don't have to avoid these foods that show up on their test forever. And over time, they can become non-reactive once again to those same foods. Number 7 is proper supplementation. You know, oftentimes many natural medicine doctors will use a lot of supplements, while mainstream or conventional medicine doctors often use none. But it's not about the amount of supplements, but the proper usage of the supplement that actually helps your thyroid. You know, I often see people buying bulk supplements at the local grocery store, not just for their thyroid, but perhaps other health conditions or just to maintain overall health. And it's really important to know which supplements can help or hurt the thyroid. And yes, there are certain supplements and vitamins that can actually harm and make you worse. And so you obviously want to avoid these. But we first need to know which ones are the best for you personally. And number 8, you need to be monitored on an ongoing basis with your thyroid condition, because your health and your needs can change over time. Sudden stressors, loss of a loved one, really almost anything in life can affect your health, and monitoring allows us to see potential problems even before they happen, and obviously allows to lessen the effects of other potential issues. Even if you're feeling great, you want to make sure that that stays consistent. You also want to make sure that you're making consistent efforts and progress, and if things need to be adjusted, that you make those proper adjustments. So these are some really important points that we went over today. And if your doctor is covering all these, then you should be in great hands, and you should know that you are taking the necessary steps to heal your thyroid and get back to enjoying life. So I'm Dr. Crifase signing off here, and I'll see you next time.